were fabulous. The kids were generally happy, interactive, very open, fun to be with. They all had the same complaints. They all were malnourished. They all had parasites. They all had grippe, which is the cold or the flu or some sort of not feeling real well. So seeing 5 patients at once is exactly like an assembly line. I always started with the older children, and then the younger children could watch and see that this wasn't painful, this wasn't scary. And so by the time I got to them, they knew the whole routine. They opened their mouth, they turned their head for their ears to be checked, they knew what the routine was, and they knew it was going to be okay. It worked very well in families when there was one mother or grandmother who accompanied a number of children. They frequently had all of the same or similar complaints. And then you only had to give instructions once to the one adult. I think one of the good things that we did with our clinics was to involve the health promoters in each of the villages and have them hear our message and hope that they will continue that message after we leave. And I think Rita has seen a lot of progress. The health promoters know the spiel and they're getting comfortable with it, and they are washing their hands. And that gives that self-sustainability that Rita has been talking about for the last 14 years and has been striving for, such that ultimately we can disappear and they can carry on.
There were many events that were spontaneous that popped up. There was a 9-year-old little boy that had his foot caught in the spokes of a motorbike and was carried in literally, right after it happened.
¿Tiene dolor más?
Sí. ¿Tiene dolor aquí en la rodilla?
We had some wound care supplies there handy to be able to treat him, wrap the wound, cleanse it, and then send him on to the public hospital to have further evaluation and x-rays. One of the last villages that we held a clinic in, Cotui, that presented a little girl, I think she was about 2.5, maybe 3 years of age, and her mom was holding her and said, she really didn't know what was wrong with her daughter. She was unable to stand or sit or hold her head up, and she had been that way since birth. Was very well taken care of in terms of cleanliness, and you can tell that she was very loved and cared for by her family. I would say she had cerebral palsy. The mom had gone to a doctor in the past, but was unable to maintain her physical therapy visits into the city. She couldn't afford the transportation. And so I spent some time with her, teaching her some basic range of motion exercises to keep her limbs from contracting and doing gentle passive range of motion with her. She was one of the faces that I'll definitely remember from my experience there.
One of the primary things that I didn't expect was the degree of functional blindness, and that was a big shocker to me. They couldn't see the beauty all around them. For us, we're looking at these beautiful palm trees, and coconuts and bougainvillea flowers, and just a lovely environment that even though they lived in poverty, there was beauty all around them, which they appreciated. I mean, they sang and they smiled and they walked through the campo. But that was what we saw. What they see is blurriness. What they see is, are they grabbing the right thing to cook with? She was actually escorted over because she was blind, and it was very clear, just looking into her eyes, that she had bad cataracts.
La colaboración de la comunidad.
Sí, sí, muy bueno.
Through the contacts that Rita Severinghouse was able to set up through the Lions Club, that they have an ophthalmologist that offers some surgeries, and Rita has the phone number of some of the people in the village who do have phone numbers, and she essentially kept a log of these people for referral, and that we'll get contacts in the future and hopefully get them into the Lions Club clinic. And, it's a very fixable problem.
Pretend germs.
One of my primary jobs was to teach hand washing skills to the village health promoters and children. Hand washing is the #1 way of prevention for infection control. We would take a microbial lotion and have them put lotion on their hands and rub it in. Then I had a black light, which I shined over their hands to see where the lotion, the microbes were in their hands, in the crevices, in little cuts and stuff.
See? Okay.
Then I had them wash their hands, soap and water, and I had them sing the birthday song, 20 seconds, typically 20 seconds.
Excelente.
We would hold their hands after they washed them under a black light, and then we'd look to see if there's any areas that they missed. The idea was to teach the teachers. And so the health promoters are the primary educators in each of the communities. And so if you taught them, then what they would end up doing is I would stand back, and then they would bring in one of the clinics, brought another healthcare promoter in and show her how to do it, with the idea that everyone would learn it, and then they would go out in the community and teach the citizens.
There you go. So 15 to 20 seconds.
And the idea is to show the community how they can be agents of change by learning one basic skill about hygiene. Many of the health promoters, they would approach me or approach the instructors and ask them was there information that they could keep? And we went very ready for that. We made laminated posters that they could then take to their community and have it available as health promoters so that they could show with just the basic soap and water what folks could do. This is the second time that I include breast self-exam in the clinics. Dartmouth-Hitchcock was very generous in contributing the models that were used for that training. We had a nurse who joined us on the trip, Chris, who would spearhead that. And then we recruited a member of the community of Cotui to assist Chris. The women in the Dominican Republic are not receiving instructions in regular breast self-exam or screening mammograms. So this becomes important in the village communities where they have no access to health care whatsoever. Something like mammograms is at the bottom of the list. So we have run these clinics with the intent to offer education and awareness. There isn't as much follow-up, although we did do a couple of referrals, which is also a wonderful success, where women did discover concerns and then go on to a provider in the community to have a follow-up. And at that point, she's had a little bit more education and information as to what she should have been looking for.
Okay. So